Governor Mitt Romney is attacking President Obama in a new ad, saying the president cut more than $700 billion from Medicare. The Obama campaign calls that dishonest, since the president is not cutting benefits. Medicare became a major campaign flashpoint after Romney tapped Congressman Paul Ryan as his running mate. Ryan is a leading voice for Medicare reform. Darren Gersh takes a closer look at Ryan's bold idea.
Paul Ryan's Medicare plan basically sends checks to seniors so they can choose their own health insurance. In addition to being patients, the goal is to make them better consumers, too.
The central idea is to give health plans and, of course, the providers, doctors and hospitals and others, a relatively fixed budget for the year so that they know that instead of just prescribing more tests, doing more things, that instead they've got to find the best way to treat the patient in the most efficient manner.
The critical question is how the payment seniors get from the government, called premium support, changes over time.
Critics say the Ryan plan's premium support will leave seniors short.
Because it doesn't keep up with healthcare costs, over time it depreciates, and the difference, that's going to be made up through higher copays, higher deductibles that seniors are going to have to pay.
Seniors will come out ahead if insurance plans are able to deliver a more efficient system. But the Congressional Budget Office estimated the Ryan plan would instead shift costs to seniors, leaving them paying far more than they would under traditional Medicare.
It is possible that something like that could happen, but that would mean that truly we're sunk in this country in the healthcare, because that would mean that all of the waste and inefficiency that everybody on all sides points to cannot be reduced. And that's an unreasonable expectation.
The Ryan plan does come with safeguards. Insurers who take on sicker patients would get higher payments for the added risk. But critics say that risk adjustment may not work.
You're inviting private insurers in, and you're going down a very untested path. And the tests we do have shows that these private insurers don't give you a better product, many of them. They cherry pick the healthiest seniors. They attract them and they leave Medicare, traditional Medicare, with a sicker population.
Here is one thing both President Obama and Congressman Ryan agree on. They want to limit the growth rate of Medicare to little more than the annual growth rate of the economy. But Ryan puts the risk of missing that mark on seniors, while the president would keep it with the government and, by extension, taxpayers. Darren Gersh, NPR, Washington.